Hi there, this is Isabel from Autism Untouched. Good afternoon. It's almost time for me to go and fetch Matthew. I'm just making sure I've got enough time to get prepared for him. But yes, I want to share this video about behavior therapy. I think you call it behavioral therapy in English. And that is something that I really felt on my heart before I go to fetch Matthew. And while it's fresh in my mind, things that happened to Matthew while he was undergoing behavior therapy is thinking back again about how much I learned about it. And I want to share with you the experience that Matthew had with behavioral therapy. Um, it helped me in a way to understand some of the problems, the challenges that Matthew had, but it also showed me a lot of things that was just him being autistic and not really being a behavior problem, but more being a matter of individuals believing that autistic individuals should behave a certain way, and it's not always possible. So I want to talk to you about the reasons why you would seek behavior therapy. I did not seek behavior therapy for Matthew to start out with, and I want to explain to you why. In the first special needs school that Matthew attended, he had a lot of anxiety and problems that was actually it was rooted in the school, not in him personally. And that's something I only figured out after a few months that he was in the school. Prior to Matthew going to the special needs school, he was in 3 kindergartens. The last kindergarten that he went to, it was the only one that he was really being accepted that he is autistic and that he cannot help for the way he processes things and for his sensory needs being different from normal kids. And he was really he was being understood, and he had no behavior problems except for trying to once or twice climb over the fence. And overall, the kindergarten that he went to before he started his first school experience, they got in the help of a special needs teacher once a week to work with him. They had someone, a teacher aide who knew how to do um, deep tissue sensory massages, which helped him quite a bit. So he was really in a happy place. He was only there for about an hour or 2 hours at best per day because they didn't really have the staff to take care of a special needs child. But I was thankful for the time that he could spend there. Point is, his needs was being met when he was there, and that is quite a big issue for special needs kids, is when their needs are not being met and they're not being heard and their way of thinking is violated, then they tend to develop behavior problems, which is what I saw with Matthew. At home, Matthew was very obedient, not stubborn at all. He was doing what he was asked to do. He was doing his best to work with us, with his siblings, and with his parents at home. We had no problems really with him. He was doing well with all the aspects of toilet training, and I mean, he had a few issues, but I mean, you know, as autistic kids do, but overall we had no problems. So you can imagine my shock when I got a phone call when he just started school at the special needs school, the first school he attended. I've told you about that, and from a behavioral specialist saying that Matthew needs behavior therapy because he's got some behavior issues. I was open minded, willing to listen, and there was one or two things that they said that he was doing that they were not happy with. But the strange thing is that the one thing was he was not wanting to stay. They took them out in that school like once a week, maybe for half an hour, to go play at a nearby playground on the school grounds. But there was no grass or no play area in their own school. It was just basically two classrooms. Like I said, it was closed off completely, hardly ever got much fresh air. So he was completely frustrated because he's healthy, his mind is alert, his body parts are all working. He was in a frail care class, but nevertheless, he was extremely frustrated. But not only that, I personally believe there was a high staff turnover, and you know, in the little time that Matthew was there, the 6 months, I think every 2 months there was a new teacher. Every second month there was a new teacher aide. Every the teachers were coming and going. It was quite confusing to me, let alone for the autistic child. So those are all things that I'm mentioning here so that you can start thinking if your child is displaying behavioral problems and the school tells you that it needs to be addressed, you've got to be open minded, yes, but you also need to do a bit of investigating why your child is displaying that problems. Because in the beginning of Matthew's journey with autism, I was really so ignorant. I was thinking that I must be thankful that any school is willing to take him because of his autism. That was the idea that I got from the Ministry of Education, is that there's no school who will take him because he's autistic, but the special needs school can accommodate him, which was good for him. I mean, if you look at the latest videos that I showed you, I have moved him to a new satellite class at a school in a special needs school setting, but in a mainstream school. He's not part of the mainstream school, but he does get more exercise outside, fresh air time, and that makes a huge difference. So, what was happening? I was getting a lot of complaints. I've talked to you guys about this before, about him being aggressive, him not being obedient, not wanting to do any schoolwork, um, throwing things around. Now, when these behavior problems were presented to me by the behavior specialist, it was overwhelming because the way he was saying it, it was like he was trying to give me ideas of how to cope with Matthew about when he tries to act out or have meltdowns. But the problem was I was not having these problems at home, and I was too polite to just tell him about it. But as I've told you before, I had a mindset change, and I no longer keep my mouth shut for anybody. So looking back, Matthew was being violated by that school, and he was doing things like taking his clothes off. He was urinating outside on the school grounds. They had this massive case file of behavior problems he was displaying at school. Every day when I went in, think about this, for 8 months, they were telling me about something that is doing wrong, something that is, I mean, they were bombarding me with it. And it was, when you go to a beach and you go in the waves, and the wave starts getting bigger and bigger, and basically eventually you back out and you rather go home if the waves are getting too rough. Well, it was like that with me. I was getting all this negative information every day about Matthew, nothing positive, and eventually I blew my top. I just told them, look, he's not happy in the school. And they tried to blame the behavior problems on Matthew. I was not having those problems at home. The things that he was doing at school, like taking his clothes off and urinating outside, those were all things, and chewing on his clothes, those were all things he was doing as a shout, a call for help. I didn't see it immediately. But you know what? That gut feeling, something told me from the start that he was in that school. After I was basically forced by the Ministry of Education to put him in that specific school. I wasn't given any other options. I went to a lot of mainstream schools, but because he was diagnosed with severe autism, and of course it said so on his record, so nobody wanted to give him the time of day. So, or take him in a school or give him a chance. But that's fine. Sometimes when you start out on your autism journey, it might look rough, it might look impossible, but don't let any person tell you your child has behavior problems when they are reacting emotionally unstable or aggressive because of things that are being done to them, not because of the way they are. So, now this is what I want to tell you. When you are approached by a teacher about behavior problems, you must ask yourself to start with, am my child displaying this problem at home, or is it only at school? You'll quickly be able to distinguish between what is actually going on. Sometimes you'll tell me, okay, but now I know he's not like that at home. What is it going to help me? You know what? If you don't open your mouth and you don't say something, nothing's going to become of it. Then they're going to label your child with certain behavior problems which they really don't have, and they don't deserve it actually. So what I did was I worked with a behavior specialist. I took on board some of the suggestions he made when it was called for, but you know what? At the end of the day, I took my son out of the school that he was unhappy in. I put him in a new school where I could see he was thriving more from day to day. The behavior problems that he had when he was in the wrong school, not being respected, not being treated with dignity, those problems were not existing anymore. The behavior specialist, I can't remember when last I've heard from him, because when Matthew was in the right environment, being treated with dignity and respect, and of course being there is discipline, there is routines and guidelines to follow at school, but he was not being kept as a prisoner anymore, like in two classrooms closed up the whole day. He was allowed to go get fresh air and go out. They was taken out to other places, and me, I I started taking him out to public places, exposing him to new adventures and places. The behavior problems that they said he had, and displaying, like throwing himself on the ground. When I took him out of the wrong setting, those problems were no, he stopped chewing his clothes, he stopped having meltdowns, he stopped resisting his work to do schoolwork, was a changed person. What was it? Was it the behavior specialist that worked with him? No, because even while the behavior specialist worked with him, nothing was improving. The only thing that was different is I blew my top at school because of all the negative feedback. Never a positive word from the school. And then they started not telling me negative things all the time. But the whole atmosphere was anxious, was stressful. There was no longer a bond of trust between me and the teachers. And the moment that you cannot trust your son's teachers or your daughter's teachers anymore, or the teacher's aide, then you've got a problem. You need to speak up. Because behavior problems with autistic kids, it comes from a place of feeling out of control, feeling violated, feeling frustrated. But if your child is taught in the right environment and they are being respected and understood for the way they are, you won't have those problems. And that is a fact, because since Matthew has been to a new school and he is getting more stimulation, do you know what? The behavior problems is gone. I've got the same kind, generous, affectionate boy back that I had before he was in that first school. It took him a few months. Remember, an autistic child is they are very much routine based. They are routine kids. They like the same things every day. That is just how they are. And I found it took my son a long time to trust me again, to take him to a class and to trust the people that was working with him. So if your child has, you've taken him or her out of the situation that they were in that was stressful for them, and they're still displaying anxious behavior, be patient. It took Matthew about 6 months before he wanted to be in his new class, before he was trusting the people that I left him with. Because the adults in the previous school, they did not respect him. And an autistic child is not stupid. Just like you and me can sense when somebody is disrespecting us and is treating us unfairly, they can sense the same thing. They know when they are not being treated fairly and when they feel discouraged about a situation. So, yes, when your child goes for behavioral therapy, make sure that you know the reasons why they are going for it, and you know in your heart that it is actually something they need to learn to cope with, a certain behavior pattern that they need to part with. Make sure it's not something that was born and rooted in somebody violating them and disrespecting them and scaring them, basically. Make sure you know what the root of the problem is, and then you decide whether your child still needs the behavior therapy. Because after I exposed in my son's previous school some of the teacher's behavior towards him or the teacher's aide, things that I saw that I wasn't happy with, after it was brought to the light, the behavior specialist, we spoke with each other, and it wasn't long after that that my son was not seen by him anymore. Going to a new school, Matthew has been in this school that he is in now more than a year now. Not once have I had a phone call from the behavior specialist that any of the problems he had previously has been encountered. In fact, I have only heard good things in the past few months because I've made sure that my son's teachers and the teachers' aides understand that I believe in my child and I respect him, and he will work with anybody and give his cooperation if he is respected and treated with dignity. So that is all I wanted to say. Thank you. It's Isabel from Autism Untouched. Bye-bye.